Will uterine fibroids affect pregnancy? Well, we're going to talk about that today. I'm Dr. Perkins, a board-certified OBGYN, and I'm like super passionate talking about fibroids. So if you've been here on the channel, just know we'll talk a lot about fibroids. And so if you have comments and questions, you're in the right place. Come on in. So in this video today, we'll talk briefly about what are fibroids and why do we need to know about them and why do they bother us. We'll talk about how those fibroids may affect a pregnancy. We'll dive into some of the complications that may arise because of them, and we'll also talk about when to seek help. So let's get our education on today. All right, so what are fibroids? Fibroids are considered to be non-cancerous growths. You may hear them say that this is a tumor of some kind, and the word tumor can be scary. And I agree, I hear tumor and I'm like, wait, hold up, what is this? And so it could be scary, but fibroids are very, very, very common. And yes, they're predominantly non-cancerous. However, 1 to 2% of them can be cancerous. So it's important that if you do have them, that you are working with your provider and just listening to their recommendations so we can be sure that the ones that you have are not cancerous. And so let's backtrack a bit. So they're fibroids, and in medicine we call them leiomyomas, or myomas for short. Know that fibroids usually come in multiples. It is very unlikely that you'll only have one fibroid, okay? Now let's think about this. Inside of your uterus, we're going to bring IV into the picture here, okay? This is an enlarged uterus, okay? You have 2 fallopian tubes and your ovaries. And so inside of your uterus, you have muscles. Your uterus is a muscle that grows with pregnancy. It stretches like it should. And so a muscle fiber can break off from your uterus and begin this cascade that leads to a fibroid formation. And it's a cascade because it's different from what the normal uterine muscle should look like. In fact, they become very hard, like a rock. And they develop in the area of your uterus where the muscles usually are. And so with that, fibroids can be in one of 3 different locations. And it's important that you know that. And it's important that you know the size of your fibroids as well. And as I was mentioning a little bit earlier, that fibroids are usually not just singular. They may start as small as a rice grain before they get to these sizes, and they can be larger as well. And so the likelihood of just one is slim. I can tell you that a majority of people who have their fibroids removed may go in saying, hey, I have 2 fibroids, I'm having them taken out. And then the surgeon like myself will say, well, we took out 13 fibroids. And every single time I have these conversations, patients are usually shocked, like, wait, I thought we only had 2, or I only had 1, and you took out 15. That's because they come in packs. They're usually multiple at the same time. And so inside of your uterus have 3 different layers, and your fibroids can be in all 3 or any of the 3. And so the inner area where your periods come from, or where your pregnancy might be growing, is a submucosal area. And so those fibroids are most problematic. Fibroids can also be in the muscle, or it could be on top of your uterus. And so the further your fibroids are away from the center of your uterus, the less problematic they are. And so if they're on top, we're okay with those. So because fibroids are so common, especially in the reproductive years, fibroids tend to grow during that time frame as well. This is because fibroids love hormones, and during your reproductive years, you have lots of hormones changing from month to month during your pregnancy, and so much more, so that fibroids will grow. And what we know is that once you get to menopause, when the hormones go down, your fibroids shrink or go away. And so they are predominantly a hormonal problem. And so if you're pregnant now, you're just like, well, what do I do? I am one of, the 70% that got a fibroid, and what do I do about it now? Well, during pregnancy, we can't do much. What we want to do is we want to be aware of the complications and the possible symptoms that may happen. And you want to have good conversations with your doctors so that you are prepared and that they are prepared with any outcome that can happen because of these fibroids. And so what are those risks? Well, the first is in your periods of trying to get pregnant, you may have a miscarriage if you have fibroids that are on that inside space where baby should grow. Those fibroids are called submucosal fibroids. And so whenever fibroids are in that inner space, they fight with a possible pregnancy implanting itself in the uterine wall. And so when a pregnancy is so super tiny and a fibroid could be as big as this one, the fibroids can win, and then the pregnancy will fail and lead to a miscarriage. So that is risk number one. Now, the next risk that I'd like to mention is having pain. And so I'll talk about myself in this scenario because pain can happen at any point in pregnancy. But for me, pain started by week number 7. This is finding out that I'm pregnant like 2 weeks ago. And I'm just like, why am I having so much pain in my pelvis? Now, my fibroids are on the right side. And so I noticed that in early pregnancy that walking became difficult. Or I would exercise and I'm in excruciating pain for 3, 4, 5, 6, sometimes even 7 days after a workout. And it just blew my mind because why am I in so much pain? Now, think about this. If you have fibroids living in your pelvis and your uterus is growing because of this pregnancy, as it should, the fibroid is growing with your uterus, but it is now pushing on everything around. You have a small space and large fibroids. The space can become tight as your pregnancy is growing and prioritizing this baby. And so what happens is that the fibroids may push on nerves, which may lead to pain. They may push on your bladder, which then makes your bladder unhappy. They may push on your bowels, which makes them unhappy too because we don't want a problem. We've been living perfectly fine for so many years. Now we have masses and things pushing in our space. And so pains can arise. Constipation can arise. Difficulty urinating can arise. Walking can even be a problem, as I experienced myself. Now, these pains can continue throughout pregnancy. And so if you're having pains with your fibroids, please do talk to your provider. Now, imagine that you've arrived to your 3rd trimester. You're in the last 12 weeks of pregnancy. You've survived it. You are over it. You're ready for this baby to be here. And you may be wondering, well, what other possible complications are there? The first I would like to say is preterm labor. Preterm labor means that your body is going through a labor process where you have contractions, but these are occurring before 37 weeks of pregnancy. At 37 weeks, you're considered to be full term in your pregnancy. So that's about 3 weeks before your due date. Anything before 37 weeks is considered preterm. And so if you go into labor prior to that, this can be due to fibroids being amongst the muscles of your uterus and causing them to have contractions way before you ought to. And so if this happens to be your scenario, please do see your doctor, call them right away if you're having contractions and you're not yet at 37 weeks, which means you're not yet having a full-term pregnancy. So that's very important so that we can intervene before you have a preterm delivery, which means your baby is actually delivered before the due date or before 37 weeks of pregnancy. The next possible problem in pregnancy is having something called a placental abruption. And what this means is there's a placenta that is producing and allowing all your blood flow to pass to your baby. And that placenta is connected to the inside lining of your uterus. And literally, your placenta should stay kissing your uterus the entire time until your baby is delivered. Then your placenta peels off and then comes out. Now, in a placental abruption, it means that prior to your baby being delivered, your placenta begins to separate from the inside part of your uterus. If that were to happen, then the blood that usually passes directly from the uterus to the placenta to go to your baby is no longer going to your baby. And it collects in this space in between the placenta and the uterus. And so this is an emergency because your baby is no longer getting the blood that he or she needs. And if that happens, we can even have like a stillbirth, and babies can die because of that. It's important that if you feel any changes in your third trimester, if your baby isn't moving as well as you normally would experience, if something doesn't feel right, if you have bleeding that is sudden, you contact your doctors immediately to make sure that this is not occurring. Now, the last thing that I'd like to mention as a possible complication of having fibroids in pregnancy is that your baby might not be in the right position because of these fibroids. And I'm going to show you what that may look like. If this is our pelvis here, this is our baby. Initially, in early pregnancy, babies may flip many different directions. They'll do whatever they want, right? Once you get to about 28 weeks of pregnancy, to about 32 weeks of pregnancy, babies will flip into the correct position down in the pelvis as such. And then they remain in that position until the end of pregnancy. Now, if you have fibroids such as this one, and we're going to put this baby back upright, and say the fibroid is right here in the front of your pelvis. Hopefully you'll be able to see this well. Baby may try to flip, but baby keeps hitting into this fibroid. And so what happens is that baby tries, but it's not working. Baby goes back upright. And then baby may come and try again because it's like, oh, I know it's time for me to go down, but this fibroid is in the way. Baby may stay upright. And then now you're 36 weeks of pregnancy, 37, you're full term, and you're just like, my baby is still not head down. And what do? Well, if babies are not in the right position, then now we're talking about possibly having a C-section to deliver your baby. And so while we've talked about a lot, those are the major complications or problems with how fibroids may affect your pregnancy. And so in general, we want a healthy baby and a healthy mom, right? And so if we have a C-section, it's not necessarily desired, but we want a healthy baby. So we want to be open, but we want to have conversations with your doctors about all of these risks. And you want to communicate with what you're experiencing and what you're feeling throughout the entire pregnancy. And now if you're wondering, well, what can I do about these fibroids in pregnancy or beyond? Well, I have a free gift for you. I'd love to share this information with you where you can learn beyond this short video about how your lifestyle and what you can do to help to decrease or lower the chances of your fibroids growing, and how to take care of your body when your hormones might be raging and these fibroids might be getting all the good stuff they want, but not what you want. And if you want this free ebook, it's called Hormones Don't Lie. Click the link below in the description area, and I'll send that over to you so you can start your journey on how to improve the health of your hormones internally. Thank you so much for being here today. Listen, if you've learned something about what we've talked about today, leave a comment below. If you have a question, do the same, because I read them all right? And so I want you to join us for more conversations like this. And I'd like to say thank you for being here and listening today. It's my pleasure. I'm Dr. Perkins again, a board-certified OBGYN. I care about you. I care about empowering you, and I'm thankful that you're here in this process and in this journey together. Thank you for joining us.